Start the recording. Yeah, good afternoon, everyone. Good afternoon, Sandeep. Very glad that you gave this opportunity to collaborate with ISODA. We have a lot of members who have already expressed interest to see how they can collaborate in their healthcare project. Just a small introduction of yourself, I would like to give to our association. Sandeep, like I was talking, is not new to IT. I think he has a mix of IT and healthcare knowledge as well as experience. He's a graduate from NIT and a postgraduate from IIM, and he's very keen to be associated with an association like us, where members can take advantage of collaborating with them to get into the government space healthcare. So over to you, Sandeep.
Thank you so much, Vinodji. For introducing to ISODians, and thanks for having me here. And it's a great platform. We would like to, interact with all of you and very aspiring leaders and aspiring entrepreneurs, seasoned entrepreneurs are here, right? With that, I will just like to share my screen. To let me know once my screen is visible.
Yeah, it is. Yes.
Visible?
Yeah.
Thanks. So we discussed, just a quick introduction that why I'm here, what was the purpose of doing this. We're going to have this all discussions. We are working with Government of India, Ministry of Health, and we are the one of a consultant there, and we are advising Ministry of Health in a lot of several programs. As you know, EY is a partner with multiple government agencies and government bodies and ministries, whether it's Aadhaar, UIDA, whether it's Umang, whether it's income tax, whether it's Agri, whether it's any stack you talk. In large, huge programs which we have done, MSME. You name it. You found some way, some part. UI is there, and whether it's directly, whether it's indirectly. Some context we definitely go and always do that, right? So the purpose of today's interactions, I'll just keep it very structured I have a deck to present for all of you. It's cover of 30-35 minute deck, and then we'll have interactions more to understand this program in more detail, right? So with Ministry of Health, as all of you may be aware of about the Ayushman Bharat and the digital health program, the Ministry of Health is actually long back, around 5-6 years back, they realized that there is a need in this country to digitize the health system, right? We all have seen, as we all are in a part of IT and ITS, organizations and leading, driving. Somehow we are contributing at all the context, and we all have witnessed the revolution which has been happened in the banking industry, the revolution which has happened in telecom industry. We all are witnessing in last 5 to 10 years how the entire world, the entire globe has been revolutionized in the platform, right? Everything is moving towards the app and platform based stuff, and how this platform based
सिर्फ
systems is
5,000 रुपए का
completely
डिस्काउंट है
digitize and
कितना डिस्काउंट है उस पर
revolutionize the entire world today. So keeping that context, somehow somewhere we all have seen the great success story of UPI in India, which has just happened in a 4 to 5 years of a time span, right? We have seen the Aadhaar, how Aadhaar was picked up. We have seen now multiple domain. We have seen a few of you must be working with government. You have seen then lot of initiative has been taken in the eGov side, where there's a one motive is to how to make a ease of life for a citizen, right? And then there is a huge investment from the digital transformations, digital interruptions and all. So keeping all that in mind, somehow being directly, indirectly experienced health in our life, right? Whether it's some of our family member, whether we are our cell phone or maybe somewhere around, right? So somehow, like, in health, we all, believed or been accepted the entire things as it is. We are not demanding. We are happy to carry all the prescriptions. We are happy to carry all the reports. We are happy to forget all the reports. And we are happy to go each and every doctors with all the report, then again taking the paper, going to somewhere else. So we made our life, we made ourselves adjustable to whatever it is available in the India, right? Right. But the way, at the same time, we are doing the banking transactions, we are doing a lot of things digitally. We never expected that why this cannot be done. And because we are not also going and asking and creating a demand, and then demand has to come out from a lot of sides. I mean, maybe government need to initiate, maybe we need to initiate. But in COVID, we all have seen the importance of digitization and digital in health, right? Which somehow this clinical fraternity and the doctor fraternity has rejected this telemedicine long back, remote consultancy long back, and they all embrace that during the COVID period. So government of India has come out with the some standards and template that if you're doing a consultancy remotely, then you need to follow this particular template of a e-prescription made by government of India. So if you do a consulting, you have to give a e-prescription to a patient. That's one of a man. And then things started moving. Then people also started realizing on the all the end, this is really solving our problem. Really solving a problem for a person to transport, drive a car or take some transportation and come to me and see and do. And we solve a lot of problem. If there is no physical need or physical examination on certain things where you need physically, you can do a lot of stuff remotely in the health. So that's a way, like, people started doing it. They started, um, actually, collaborating with the digital transformations. So keeping all that in the mind, government of India has also taken a lot of steps. You must have heard about like Ayushman Bharat, and then there's Ayushman Bharat is a huge, large scheme. Under that, there is a Pradhan Mantri Jan Arogya Yojana. In that, uh, government of India gives 5 lakh rupees per family, around 10 crore families and 40 crore population, which has been covered. And recently, you must have seen that government has announced that going forward after the elections and all, they may going to add the senior citizens in part of that. Okay, whether they're below poverty line or out of poverty line. So a lot of things are happening. But at the same time, then they realize the hospitals and the health facilities across the India, whether it's a lab, whether it's a hospital, whether it's a pharmacy, whether it's a private clinic of a doctor, everywhere you go, somehow they do a digitization. Somehow they have a pause to give you a billing. Somehow they are doing it, billing and all. But at an extent beyond the billing, when you are asking something, your electronic records, your clinical records, they have failed to do that. They are still believers on to give you the papers, or a very sophisticated, very good institute, then they can give you the PDFs in the mails or in the WhatsApp form and all. So people are coming out. So it's happening in the large corporate hospitals and all, but not with all the hospitals and all the facilities in the India. And slowly, this will going to be make kind of an indirect demand by government that you have to do that, you have to do this stuff. So before moving ahead, I just would like to tell you all that what is this ABDM all about. So here. So the Ayushman Bharat Digital Health Mission is a national initiative by Pradhan Mantri, which I've already told you. It has been developed keeping in the mind to build the digital ecosystems for the country, and then to do a seamless health record exchange between a one facility to another facility for a patient, keeping all data securities and everything in the mind. It is there. I will cover all that how this all construct has been built and all everything is there. So, I mean, if I just talk about this benefit of an AVDM for a three stakeholders, large stakeholders, there is a health professional, there is a patients, there is a facilities. Okay, facilities, when I say it's a health facilities, whether it's a hospital, whether it's a diagnostic center.
Sandeep, 1 minute, please hold on, Sandeep. Samina, will you mute everybody, please?
Done, sir.
Yeah. Sandeep, you can continue. Sorry for this disturbance.
No problem, sir. No problem. Thank you. So, sir, I mean, health professionals enhance discoverability of the health professionals and all. You can see all this stuff, but I don't want to go each line of line. What is this health professional? What is the benefit for a patient and facilities? And let me tell you in a very layman language and fundamentally what government of India was intended to do and how they trying to solve the large problem with a collaborative effort. That one piece of that I will take care of that. When I say I will, that means government of India will take care of that. And one piece of ecosystems, you facility level go and take care of that. So while I say this, what is this? What is one? So let me explain it in a very layman language. Suppose I am a patient, and let's say I fall sick today. I just looking for a doctor who's nearby me. I know him, my family doctor. I go and just talk to him and visit his clinic, get a prescription from him, and then he prescribes certain medicines. And I'll go to a pharmacy, buy some medicine, take some medicine, and get well after 4 to 5 days. If I don't get well, I again call him, and again I do a follow-up after 3-4 days. Then he realizes I'm not getting well. He again prescribes me the second prescription with some, let's say, tests need to be done, and asked me to come out with them. Let's say we went there and done some test, and then for the test I have to again go to a diagnostics labs and get my test done. My results came in. They again gave me one lab report. So I have a 2 prescription now. I have a 1 lab report also. So there is a 3 medical records today I have with me in form of papers. Okay. All these facilities, this doctor can have my prescription stored in his database if he could have do it digitally, right? If it is not, then it is not available with him. If there is a diagnostics and they have the system, software systems, they may have my lab reports with them in their database. And I also have a copy of that as a form of paper and also as a form of soft copy in the PDF. This is what is a practical situation today, right? So I'm just doing a case-based explanation so that you people can relate, and I'll just set up this context and then we'll come to the program. Otherwise, when I'll start talking about this stuff, it will be all like a common jargon. You will not understand that what's the need of this program and what is the intent and what is the vision and mission for this program for a government of India. So then let's take an example. I came back with this test report to a doctor. I again pay a visit. So this is the report. Then he realized that my report is not good at all, right? And I need to immediate some referral. So he referred me to a nearby hospital. You go and get it admitted immediately there, that you need a immediate medical attention. With all 2 prescriptions and this and his referral, I go to a hospital, and then probably I saw some doctor there and all. I met, and then I have given my all the records. Basis that they all again examine me, whether it's in emergency, whether it's in anywhere, and then they realize that need to be get admitted. Okay. During the admission process, I mean, if any of you or maybe all of you may have experience that if you are having a cash, you deposit cash, you get it admit. If you don't, then you have a personal insurance. If somebody is working with the organization, have organizations. If somebody is working in the states like Rajasthan or states like others, where there is a government gives you a scheme, everybody has that card, give to that and get admitted, Right? During the admissions, they again do a pre-authorization check with the insurance company, TPA, or the government body, and then once they get authorized, they will get you. So that's again one of a process which we'll talk later on. Okay, so let's park it for some time. This hospital and insurance stuff. Okay. Now I got admitted after the 2-3 days of treatment. I've done with the multiple tests, multiple round of 3-4 doctors has saw me. They created their own clinical notes basis on that. They keep changing my medicines. When I was admitted, I was little serious. They have done some doses, then they reduced some doses. They put it some, direct, injected medicine through IV. After that, once my recovery started, then they put it me on oral medicines. My diets has been changed. They prescribe some certain specific diet. If I am a like NCD, non-communicable disease like diabetic, hypertension, or some other disease, my diet will also get changed accordingly, right? So all this process happens, and there are some records. It's happening within the hospital, whether it's happening in paper, whether it's happening maybe in a computer or software. It depends. I don't know. I mean, today's scenario, it's 20-30% happens on software. Rest all I don't know how many of you have went to ICUs and seen there's all vitals going all, it's going. And then there is a big chart in front of a patient. Doctors comes and or nurses come and just note down those charts. Doctor comes, see the chart, take the paper, make a note. Nurses get the note, go there. It's a very highly digitized hospitals in India. Maybe Narayana, Fortis. From the Fortis, I know it is not there. Right? They may go with the tab. They may get something. Otherwise, it's not. It's all in paper. Okay. Then the day come after 3/4 that finally I'm going to be get discharged today. Doctor has wrote a discharge instruction. Basis that discharge instruction, it goes to the players, and then they all do this NOC's clearance. Same like in your hotel checkout. Okay. You get it all NOCs from housekeeping, food, beverage, all that, and quickly how fast it is happening. But is it so fast happening in hospital? Not at all. Minimum takes 4 to 5 hours or 6 hours, maybe more than that, right? So I mean, then all clearance came in, then it goes to insurance, then it get clear till the time you wait. Once this all came, then you got discharge. You come with what? A discharge summary, not the entire clinical record of yours, only summary. Because for 5 days you got admitted, there's a lot of clinical things were there, which doctor not supposed to give it to you, which doctor will keep as a medical record in their premise. Okay, and they'll only give you the discharge summary, where there's the instructions, whether it's a diagnosis that how you admitted, what was the line of treatment given to you, what was your observation now, in what condition you are getting discharged, what is your follow-up instructions, what is your medications, for how many days, then you come back and do your follow-up checkup and all that, right? So then you come back home and all stuffs are done. Then probably after 10 days, you again get done your test, went to the doctor to follow up, and your loop is getting closed. I mean, all this stuff, you've been to many places, but all these data and all these things remain silos. One data is with them. And after 6 months, when I ask you that, do you have an option that can you open your mobile app and in that, like a bank account, today, whatever transactions you are doing it, whether it's a UPI, whether it's that, blah, 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 all you can get the kind of immediate data. Do you have any app like that or anything where you can get all your health records without going there or without losing there? You say, no, it's not. And then when I go to hospitals, then again you start asking, what if all these facilities start exchanging my data? Because this all data belongs to me. I am the owner of the data. There's no policies, there is no statutory guideline as of now, but yeah, it's been drafted, it has been presented, and in a month or two, the new draft will come. Most of you may be aware of DPDP, okay, Data Protections Bill and all, which is coming out, and it is very clearly defined that data ownership of health will remain with a patient. all the hospitals, all the health facilities who is serving this particular patient will always remain a data custodian, not a data owner, like a bank. When you go and keep a money on your bank, so bank will become always a custodian of your money, not a owner of your money, right? And then ownership is always with you. And the top of all of you, there is a regulatory called RBI who regulate you, who give you a guideline how a bank will operate legitimately within some certain way of transactions required for my country specific. You cannot do all this, otherwise you will be caught as a wrong practice. Similarly, there is a banking standards, and then there is a financial standards and obligations made for people like us also. We cannot do this type of transactions, right? But in the health, somehow these things are missing. I mean, there's no things defined here. There's no standards defined here, right? I mean, today, 15 years back, 20 years back, I mean, SBI is not able to talk to SBI. If there is SBI branch in Jaipur, SBI branch in Bikaner, they were not talking. You need to go and do all transactions in that particular branch only. In the age, we have seen that how SBI is talking. We have seen how now SBI Jaipur and SBI, SBI Jaipur and ICICI Bank Jaipur in the same building, not able to talk to each other. I have to go physically to this branch, visit, do some paperwork, and then I have to go this branch and do this paperwork in this. And usually for doing a banking job, we have to take a half-day leave. Because I have a ABCD, this much of work, I'll take minimum 2 to 3 hours. Now, it's seamlessly talking to each other. I don't go, we don't go. It has been moved out from a core banking to now a fintech-based banking. It's completely UPI and fintech-driven, stuff. You actually don't need to go there. All of things are happening, but in health, it's not. So government decided, I'm coming to the point quickly. The government decided that if I go, how do we start in health? Shall we go to all hospitals and make a standard software for them and give it to them that this is what you're going to do this? Or shall we make a standards protocol and make a mechanism to exchange that health records among all that? So what was the approach? So we done a lot of brainstorming, a lot of people have been involved, a lot of stakeholder consultancy happened, a lot of global best practice has been reviewed by a lot of other countries and all, what they do, what we do, right? Some inspiration, some ideas of architecture, Indian architecture has been taken from UPI, that will take a consent-driven architecture. We will not simply exchange the health data without a patient consent. The way we don't allow any money to be get transferred to anywhere without a money's owner. Okay. So similarly, with the health, if the data ownership is with the patient, if somebody want to exchange, pull or push a data, has to take a patient's consent. So the entire framework of India architect come in the place, and then they design the architect effect, and they decided, let's build India's health exchange platform. So India's health exchange platform has been built by Government of India, which is again part of a Ayushman Bharat Digital Health Mission. And that exchange enables a health facility anywhere in India can exchange their data interruptibly between each other. Okay, using some sort of set of standards at their end. This is a health standards. Okay, maybe you have a different nomenclature. You will say somewhere you will say blood glucose, somewhere you will say glucose fasting, somewhere you will say urine test, somewhere you will say urine analysis, somewhere you will say lipid profile. Some people say it's a coronary risk profile. So nomenclature will maybe different at place to place. But is there any disease code which is internationally available? Yes, it is available. Like in banking system, there is a coding. So in the health also, there is a coding. There is a protocol, there is a standards, and everything is there. But we were not using it in India because it's now somehow like not, made compulsory, made necessarily, the value-wise, it was not valued, right? Now people realize at the top corporates and all, they all realize a lot of government institutes started taking all structuring the data, because data structure is very important. Otherwise, if you don't have a meaningful data, you can't analyze, you can't do any decision making on that. So it's a high time people realize that. But now after that stuff, the government thought of like how a patient will get ultimately benefit of that, how the exchange will going to. So we built a health exchange, and then government also built a 3 registries for that. One is a patient registry, another one is a health professional registry, and third one is a health facility registry, which is there here. The health professional called HPR, patient called the health ID of a citizen, citizen health ID, which called as ABHA ID, which most of you are aware. If you're not aware, then we'll send you a link. You create your own ABHA ID by just 20-30 seconds it will take to one small link. Click ABHA, link with Aadhaar, and then your ABHA ID of a 14-digit number generates. And tomorrow you go to any facility, give your ABHA with, and that facility need to have a ABDM compliant software to accept your ABHA. Okay, and then your all record get linked automatically, like a DigiLocker. So the app which I've shown you is kind of a health locker, right? And how this health locker work? If you have this ABHA ID. So ABHA ID is nothing but kind of an PAN ID of your health. In finance, you have a PAN, right? You go to bank, you go to open a credit card, you're going to take a credit card, you're going to take a insurance, you're going to take demat account, you do any financial transaction, you need a PAN. So everything is linked to your PAN. So similarly in health, there is nothing where you can link. All the small hospitals and facilities, they have ID. Those are an individual, facility-based ID. But somehow it is not linked to any unified ID of a citizen. So the unified ID of a citizen called the health ID and ABHA ID. Okay. And the facility ID, which you need to create the registry for a facility, is called a facility ID. And the health professional, similarly, all the caregiver like doctor, nurse, paramedic, lab technicians, everybody need to come out in this. Government of India is also creating their registry. So that tomorrow when your one prescription comes out, it has all linked. This prescription called X linked to a ABHA ID of Sandeep J, generated by a doctor called ABC in the facility called XYZ. All links are been there. And then when Sandeep moves from a one clinician, which I was when there in my same use case, which I was talking, when I'm going referred to a hospital, I simply go in that hospital and I'll say, I am not carrying any paper. My ABHA number is this, or my mobile number is this. You can extract from my mobile number. So that facility, put that mobile number. It will go fetch the data from the ABHA database of India, extract my all demographic detail, and it asked me, do you have any health records? I said, yes. Well, shall I request it? They will click a button. Immediately, I'll get a consent message in my mobile, and I give a consent. That consent is also time span. I can give it for 1 hour, 2 hour, 1 day, or something like that. And also, I can select. I may be having 20 health records with the 20 facilities, but I don't want to share with him. Certain health record I don't want to share. I can choose which I don't want to share. I deselect, I select only those which is I want to share with. And immediately when I give my consent, they can extract all the records. So extracting means they can only view. They can only view. They cannot edit, they cannot modify, they cannot download, they cannot store. Because that particular records, custodian is somebody else. He is not the custodian of that record. He is not generated by that record. So he can only view with my consent. Okay. So that's how a health exchange typically works. Now, we all realize that, okay, fine, we built this all stuff, large stuff. What will going to happen at the ground level? So at the ground level, we were actually asked all this facility need to comply with the ABDM software, ABDM Health Exchange. To complying with India's ABDM Health Exchange, any health facility who is using a software need to integrate with the 42 APIs of Government of India's National Health Authority called ABDM integration. Once they integrate their software with that, they get a certification from Government of India. Yeah, it is integrated, or they buy a software, which we are going to talk now. They have to buy and implement a software which is ABDM compliant. With that, they can able to pull the data and push the data to anywhere via health exchange. So the data storage and everything will be not compromised. Everything is there because there's a complete big guideline. 42 API need to be integrated for any software to be get complied to ABDM. Then has to get a WASA certification, which is basically safe to host certain certification from Government of India. So that particular software company used to take all that stuff to get it certified from Government of India that this particular application or software is a ABDM compliant. You all have seen in GSTN, there's a 36 GSTN service providers. I mean, how they went through some processes. So for the same processes, Government of India has also defined a sandbox environment where a software company used to go, get their software certified in the sandbox environment, and all 42 APIs they have to integrate. It works fine. Then the Government of India, there's a process, they have to become a certified one. So I'm just moving again little forward. It's not very unknown to all of you. Most of us are working in that same tech space, some of them partially in health, some maybe don't have the health knowledge, but yes, somehow we all realize with my last story, which I've quickly told all of you, that that's a basic large problem which Government of India realized before conceptualizing the ABDM and built a health exchange. So technological barrier, regulatory alignment, inadequate distribution of health resources, paper-based longitudinal record. Imagine if a patient is ill and we have found a data for a cancer patient, and it's very unfortunate that patient's data during the treatment time, it become minimum 10 to 20 kgs of data he used to carry. Not sorry, data, it's kind of all bulk paper. Because it's a very study-wise, it found that onco patient minimum used to go 2 to 3 different facilities for an opinion. And then it's carry a data and carry a lot of records. Similarly, a lot of diseases, a lot of things, it is like that, right? Then always it was a reactive approach to health. There is no preventive approach. So if I get, as in government, all these steps are there, properly data have been known, people knows what is there, they can actually take some corrective action towards the prevention of a disease or prevention of anything. So it's a proactive planning is not happening. Because we fall sick, we go to hospital, then only we come to know. And then the government realize, okay, fine, isko to ye hua tha. Abhi government ke paas mein, people who get treated in TB with the private hospital, government doesn't have a visibility. हम अगर बोल दें anemia मुक्त है या TB मुक्त है, so TB मुक्त, anemia मुक्त, maybe I can say with the data what I have as a government within the government facilities. But the people who got treated and getting treated in the private facilities, there is no data, there is no link. So government with this exchange is only exchanging the clinical record. There is no financials. Let me clear all this again, a myth that a lot of people has an apprehension, sir मेरा financials दिख जाएगा, ये हो जाएगा, कुछ नहीं दिखता, कोई financial नहीं जाता, उसमें सिर्फ patient का data, patient के पास तो उसका data होता है, उसके पास उसके अपना physical bills है, उसको किसी को कोई मतलब नहीं. आप जब pull करते हो तो health record दिखता है lab का, और इधर जब push करते हो तो उसका health record दिखता है. That's it. किसी को क्या मतलब है उसकी बिल कितना या था, क्या हुआ था, नहीं हुआ था, it's between patient and that particular facilities, right? So I mean, these are the quick large challenges which before conceptualizing this ABDM government has thought of and then came through and then tried to solve this problem. The biggest driver of driving this EMR adoptions are basically to cater 3 key areas like operational efficiency, personalized patient care, and data access and management, and then the cost saving. Imagine the time we spend to go 20-30 places unwantedly just to meet people and to give it the record because we cannot treat. So there are already 3-4 programs exist, which is SIDH program, which we are discussing right now. In my later 2-3 slides, we'll cover about the format of this program. There's one more program which Government of India is doing. It's called microsites. In microsites, you will find there's a program to digitize all the clinicians and all the private doctors who are doing the practice at a private clinic. They're not associated with any labs, any large hospitals. I'm a pediatrician. I do my own private practice, right? But I do see 100 and 200 patients, right? 60%, 50% of people don't go to hospital because they get treated at a clinic level, at a private doctor level, and they get a medicine and get it. So those records are never available to anywhere. Not with this doctor and not with me. I'm going to one doctor for last 10 years and he giving me paper prescription. He doesn't know my history. मुझे 10 साल से देख रहा तो मुझे पता है उसको रिलेशन मिल गया अच्छा तुमको तो ये वाली बीमारी अच्छा ऐसा होता है वैसा होता है ठीक that's what he has. But clinically, do he has any system to extract my record and see that in last 10 years I have done this 200 tests? What would be my trend? Where I am leading towards? How many time you have prescribed me this paracetamol which is hurting me? How many time you have prescribed me this antibiotic? Okay, nobody realized that. Even I as a patient doesn't realize it. Right? But now people are becoming more, educated, knowledgeable. So demand will automatically started coming. People are saying, no, give me up, aisa do. Aur jo de rahe hain, uske paas hum ja rahe hain. So similarly, there is one more program called DHIS, which is basically an incentive program which Government of India has started. Okay, that incentive program says the people who use ABDM software in their health facility and generate a health record using that particular software, which is ABDM compliant, will get some incentive from Government of India directly. So as of now, currently there is two incentives. There is a incentive for labs, there is incentive for hospitals, and of course the clinics, which they generate a prescription. So if a doctor generates a e-prescription in the OPD, he gets, when that particular hospital, or if it is a clinic, then doctor is the owner. That particular facility gets 20 rupees as an incentive from Government of India. And if the same patients, like I'm again going back to my use case which I was defining, after going with the doctor, I took the prescriptions, went to a lab, I given my prescription to lab, and that lab, let's say, assuming has a ABDM software, he asked for my Aadhaar ID. I've given my Aadhaar, and with that Aadhaar, he done my lab test and generates a lab report, which is again linked with my Aadhaar ID. He also get 20 rupees once he generate a lab report and linked that lab report with my ID. So that's the incentive today is available for these people to adopt it, which Government of India has started. It's for last 1 year and it will continue for maybe 1 or 2 years more to increase the adoptions. I mean, why you guys are saying like this? So the point was to incentivize. You must have seen there's a lot of program. This strategy has been adopted. You have seen how the cashback has been given to UPI transactions 3-4 years back. So it was not a cashback, was the Paytm and PhonePe were offering to you. It was Government of India. They have incentivized these players. Start this, we'll give a cashback, and then those players had transferred that that incentive to their customer acquisition. That if you do this 1,000 rupees of transaction using UPI, you will get 100 rupees cashback. I get an option. I'm using debit card for the same item, and my friend using UPI for the same item, he gets 100 rupees back. I don't get anything back. And I started installing UPI app, shifting from a core banking to UPI for a transaction only. And I also enjoy that. The moment after some time, we all tend to use that, and then we'll fall in love with that UPI and our lives become so easier. So the entire ecosystems of UPI has been built fantastically. And then today, we don't want to switch off from the UPI at some extent. Certain transactions, we are very convenient to use UPI. Certain transactions, we don't, so we don't. It's completely up to, but we have good options today available. But how did you incentivize? How did you sift that particular corpus of customer from a core banking transaction to a UPI-based transaction? Because you have done some incentivization. So this is one of a thing which Government of India has started doing it, and close 6 to 7 crores Government of India has already disbursed as of now to a lot of health facilities and doctors. Now there is an incentive for a software company also. There's an effort today, like they make 42 API integration to become ABDM compliant. So there is a no direct cash on that time, ये free कर लो क्योंकि certification में पैसे लगते हैं, सब कुछ होता है उनका, जो भी 20-25 हजार 50 हजार उनको खर्च करना पड़ता है वासा सर्टिफिकेशन कराने के लिए, सर्टिन सर्टिफिकेशन कराने के लिए भारत सरकार से, क्योंकि वो थर्ड पार्टी है बिल्कुल। तो वो कराने के बाद व्हेन दे एक्चुअली रियलाइज कि 2-3 महीने का जो मेरा एफर्ट लगा, अब वो क्या हो रहा है, उनके लिए पर ट्रांजेक्शन 5 रुपए मिलते हैं उस सॉफ्टवेयर कंपनी को, चाहे वो लैब का सॉफ्टवेयर हो, चाहे हॉस्पिटल का सॉफ्टवेयर हो, चाहे क्लिनिक का हो, एनी सॉफ्टवेयर, इफ इट इज डन एनी Aadhaar link transaction, they get a 5 rupees. So this system integrator program, which is, we called it as a SIDH. Now we're coming to this. I'll just finish this quickly in 5-10 minutes. And then we can have a question and answer of that. So, I mean, the program structure, we made it like this adoption need to be happen at a tier 2, tier 3 town, basically semi-urban and urban side. And then there's a, a scheme, something like a UPI and Aadhaar, they said, I mean, that can be only, a scale with the help of private players also come in, join this program. And with the nation building, they can build their own business. Because we're trying in this SIDH program to create a marketplace. Today, I mean, there's a huge scarcity from the supply side. There may be a demand. Demand can be raised anytime. I mean, the government can do 2 things. There are slowly a lot of things that started happening in the place. But the supply side is not yet ready. If any time it will be announced that this 20-30 lakhs, whatever number of hospitals and then this clinic need to be in a 4 to 5 months has to get this ABDM, because now this 5-6 schemes you cannot use. You cannot use governments of health, insurance in your hospital. You cannot use PPN all. You cannot give an insurance company because insurance companies started asking ABHA. This health people have started asking ABHA. CGHS, everybody started asking ABHA. PSUs asking ABHA. Everybody is asking. So only 5-10% aren't asking, but they may also ask tomorrow. So you need to have that implementation. So NHA with the system integration came to create that network. So that's one of a reason that how this SIs come in place and do this implementation. That's a quick size of a market which we would like to all of you to have a look, right? That how the Indian market and global market has been actually evolved, especially this huge spike has happened after the COVID. So globally, you will see India stands almost at a 3rd position with a close to 80,000 crore market in the digital health. So CAGR growth, if you can see the Indian healthcare sector, the private equities, VCs are start jumping. You've seen Fortis got acquired. Manipal is acquiring this hospital, they is acquiring this. Every huge acquisition, merger and acquisition is happening across for last 3 to 5 years in the Indian healthcare industries, right? Whether it's direct, indirect and all. And with that same thing, you will see the revenue growth from digital treatment and care side. I mean, close to 9,000 crore in 2004 it is, with a CAGR of 14%. And it's expected to grow again further to, 30, 40, 50% in 2028. We thought of like, it'll close the 14 crore of market. Where you see the user penetration, people like we, people like other who adopted the digital treatment and care side, it is almost 15.45% of that. So it's kind of very upcoming, very growing, very potentially very large and huge market. What Government of India has realized after this, our all data and all things, that this is a huge market. This need to be create a very proper and good ecosystem of it. So we created a health exchange. We created a people to come and, all the software manufacturers can come and get it done. But does this software manufacturer has that bandwidth to implement 5 lakh, 10 lakh hospitals in 1 year? Completely not possible. So there has to be a channel partner. There has to be a reseller type of ecosystems, and strong supply need to be there. When you roll out GST, there is a strong supply was already available for last 20 years. Goenkajis exist in Indian market to serve tally. A SME class of players and these things are already available with a huge network of their established channel partner and network partners. Similarly, all the other software companies in that segment were there. But in health, it is not. Unfortunate. So even if there is a tomorrow demand goes up with direct impact or indirect impact, maybe an impact from a patient, maybe impact from a third parties and all, like insurance started demanding, government of India started demanding, they put it some laws and rules. In 1 year and 2 years, we cannot able to capture this stuff. We cannot, there's a huge demand and supply gap. So our mandate is to create that supply chain stuff. It is not new to all of you, not new to all of us, but it is new to healthcare. And in the healthcare, especially with the software and EMR cell. It is not new to healthcare when there is a medical equipment. So when the G sell a medical equipment or Fuji sell or Philips sell, it has a channel part, right? When there is a medicines, there is a manufacturer of medicine, then there is a distributor of medicine. It's there, channel part. But unfortunately, in the software segment of that particular area, which is HIS and EMR, that model is not available very, very nicely. As of now, today, I am the manufacturer, I am the implementation partner, I am the support, and I am everything. This is what we are doing it. And that players are very small in the country. They never realized of becoming big because the market was not going big. Government is not taking initiative. No, this initiative has been already been taken. Government is trying to build and make a market for all of you. Come and play your own role. Maybe you want to become this, maybe you want to become this. There's a huge ecosystem. Like in finance, telecom, there was a huge ecosystem. Everybody has his own play. Somebody is selling tower, somebody is selling, bandwidth, somebody is selling equipment, somebody is selling a lot of things in telecom we have seen. In automobile, we have seen. In FMCG, we have seen. In banking, we have seen. Finance segment, BFSI segment, we have seen. Everybody is not a bank. Everybody is not a tech company. Right? Similarly, in this health ecosystem, when we're trying to create, maybe there are already some players, but there are maybe chances that there are two. Somebody become to somebody else and opt for something else. So that's an opportunity we are talking about. So with that, I'm going to quickly go what's the format of this particular scheme. So this particular, has been made for a tier 2, tier 3 town, and basically from a 10-bedded hospital to 250-bedded hospital target. That's all in the private segment, because private segment serves a huge number of people. I mean, if I'm sick, if I'm not well, why else I'll go to a large hospital? I go and meet a clinical small doctor and get it treated. Why I'll go to government hospitals and all? Prefer to go here. If it's something, then I don't have an option, then I have to go in the village and all, right? But if I have an option, why I'll go? I'll just ask somebody. So that's a segment which actually caters 60 to 70% of Indian citizens. And that data is not getting exchanged. It's always remain with them. When you go to lab, when you go to large hospital, then there is a PDF files are coming to you. Otherwise, in this level, there is no data. So that need to be get digitized very well. So SIDH program is focused on that particular area. There are multiple programs. There are programs for pharmacy, which my other team is doing, is to actually connect all these chemists. Then there is a program which other team is doing for connecting all the diagnostic centers. So other 7, 8 programs are running together with the larger umbrella. So all of them tomorrow, day after, maybe 1, 2 year, 3 year down the line, it will all become streamlined. So that's a quick step of how we're going to select a system integrator. So NHA will onboard system integrator, SIDH partner, and currently we have got a mandate to do this experiment in a kind of a pilot at 3 states, which is Rajasthan, Madhya Pradesh, Orissa, and Kerala. And that's how, like, we've been to all the places. Today I'm in a Cochin. I met a couple of SIs here in last 2 days, and it was fantastic. A lot of people are very excited. Similarly, I met people in Rajasthan, Jaipur, with Mr. Kumud Jain ji, and then with Mr. Dheeraj Pagaria ji, Dheeraj Vijay Varghese ji, right? I mean, they are fantastic people. They are quite, well doing this all stuffs and embasses this entire program very nicely. And thanks to them, I mean, we have now got an opportunity to talk to all these ISODians today. So that's a format which how we're going to do it. I mean, all these 4 small cities. We'll select this all, with this experience, turnover, people, what type of business they do. There are certain criteria of selection. And then once the partner is selected, then SIDH will be, get a chance to meet with all impaneled EMR vendors of their choice. They may choose which are the impaneled vendor they want to go along, what are the formats. We also help SIs to, we already made a lot of business plans. We already made, a lot of your pitch documents, sales documents, FAQs. So it's not something where you do a business with HP today, you do a business with Tally, and Government of India is coming in and helping you, right? You choose and you realize that there's a business market, you've done it. Now this market is creating, now Government of India is trying willingness, try to understand this market we're trying to create. And that creating this market, we're trying to do a hand holding with you all. And we will be always remain to make this happen. The way we have done in UPI, when I say we, then we means government, and also ENY was there. The way we have done in income tax, ITR return and all, you have all seen how we were started with and where we have landed. The way we have done it in Umang, from a DigiLocker to EPFO, how things are now completely API open. So things are now started happening in health. And this is one of the things which I'm going to talk to all of you, to aware all of you that how you will take it forward. Maybe you will be aware of, maybe today and tomorrow, after experimenting this 5 cities and states, it will be again a pan-India program. And all of you can, make a, huge takeaway from this and can create a huge business for your existing business. Top of that. So that's structure, how we're going to onboard, right? And SIDH partner is going to offering initially for the SIs, how you're going to structure. I mean, similarly, the way you are doing it today, right? You are just taking care of L1, L2 supports, selling of a license, you get a margin, then managing that, you'll get a margin of that. So it's completely between you. So in the right-hand side, if you see the bullet points, so supports healthcare facility, identifying and select EMR, help the facility to create a project, and then ensure effective EMR to first month, then, provide a local configuration, customization support. Imagine a people manufacturing a software in Bangalore, how he will going to implement it in Ladakh, JNK, Rajasthan, all places. Not possible. And the local players who are doing it today and tomorrow, I mean, there's no option. You have to become a ABDM compliant. Otherwise, you can't survive. So that's a mandate which is coming out. And things are which is coming out. I mean, right now it's an optional. Aadhaar was also an optional. But we all have an option to go to bank and say, I cannot link my Aadhaar with PAN? Do I get an option to open a bank or any financial account and I'll say I will not give my PAN? Right? All of us has seen. We have an option to go any hotel and don't give our ID? Do we have an option to admit in a hospital and don't give an Aadhaar and PAN number? Because now insurance companies are asking. Similarly, this way the entire demand started creating, and we are creating more and more and more and more in this particular, because we are trying to create this market for all of you. And it's completely up to the you people, how you'll take, how you're going to, accept, make your business a strategy or GTM to come in that and drive a game. It's completely up to you. So if I'll quickly give you a little background of that, I mean, how many players of EMR company today, which government of India has already impaneled and they are the authorized ABDM compliant people. So these are the few logos, few people who are already there. And around 18 to 20 aspirants are already in the line to get it their certification. Once they complete their entire process, they will also become compliant. Similarly, the SI's partner will also get impaneled. This program is started. That is why, like I'm discussing and clarifying you what is the program all about. Tomorrow, you will be also get listed in Governments of India's website in our ABDM. That these are the SIDH partners of Government of India. The way they are become the EMR partner of that. Okay. Then there is a hospitals who are becoming a compliant hospital of ABDM. Then there is a huge number after that. So this is, I mean, a support which we have designed that how EMR partnership, EY and Government of India are going to help you, how we'll help you to have a strong marketing toolkit from a pre-sales, pitch document, how you're going to approach, how we help you to connect with a large number of hospitals. You already have maybe some connect. We also explore some connect. We also do a lot of marketing for you. We also do a lot of social media interactions and things the way we have done it for these EMR companies now. In every government's program, they are the part they can proudly say, I'm a part of Government of India. We are doing this large program so and built up country, help building the country and help building your business, both. So that's a quick value which we just figure it out. It may explore. We'll open to have a win-and-win situation for all of the stakeholders. So there is a buyer called hospital. There is a reseller called SIDH, which you people are going to be or aspirant to be. And then there is a manufacturer called EMR vendors. So that's a ecosystem we are trying to establish, because without that, you cannot cover the entire. A manufacturer, a Punjabi guys or a North Indian guy sitting in Delhi, UP, Jaipur, if today a demand get generates that 5 states make it mandate and 5 is going to have this software, 5 lakh installations going to happen in Tamil Nadu in next 3 to 4 months, 2 lakh in Kerala, 50,000 in Bengal, and 10,000 in Andhra Pradesh. Can these 2-3 players of Jaipur, Delhi, Gurgaon, Noida go and implement all that? Can they meet this demand? Not at all. It's not possible. But if I say today, all of these players need to install Tally. In 5 minutes, we can generate the Tally key license. And in next 5 days, all the Tally partners of those particular regions can reach to this place, talk in their own local language, and get the things done. So that channel, that supply is well done in that side, but in health, it is not done. So before generating those stuffs, we are trying to first create this because there won't be any chaos in future. So that's stuff which we are trying to move ahead. And we thought of this program to start this program. This is quick onboarding, SIDS team training and all. So, I mean, I'm skipping this for sake of time. Thank you so much. This is all from my side. I'm happy to take any questions, anything, if there is anybody wanted to have it. And all of gentlemen, all of you, thank you so much for giving us time today to talk about this small journey, small concept, a small program which Government of India has just started in this particular segment. Large program has already started. People are making huge. There are more than 80 startups in last 1 and 2 years in health, which has been already started. They're doing quickly. If I'll take a couple of names like Bajaj Fin Services, you all of may be aware that a finance company already built their entire product 2 years back. That's called PHR, Personal Health Records, which I've shown you in my mobile, right? And they made a strategy that this particular app is for only doctors, individual doctors, and for a patient. And I will give this app 3 years free of cost to everybody. After 3 years, I'll start my subscription model. Somebody else have a different business model. Somebody else has a different business model. So people started making their business model basis this program now. And in this particular program, we are trying to build one more avenue for system integrators like you. You have seen the Aadhaar would be never success if a system integrator, if the people like, lot of going into the village to village, and people like Karvi, lot of same players went all places and created those Aadhaar. Government of India and those bodies were not implementing those things. So thank you so much for this. Happy to answer, to interact with anybody.
Yeah, Sandeep, good evening. This is Ashok. I'm from Chennai, and thanks for the wonderful session. Just a quick question: what is the incentive or for a hospital to go in for this program? Is there anything government is going to make it mandatory for people to make this as part of it, or is it just incentive program for hospitals? Because we work with a couple of healthcare, and I find that there's a purpose of they being unorganized. There's a purpose behind it. How are you handling that?
So, Ashokji, thank you for asking this question. That's a great question. I mean, yes, again, I'll go back. I have already, told multiple times about this particular thing. We cannot make a mandate right now. Aadhaar was never mandated. Even today also, it's not mandated. The other program we created in the ecosystem, and we asked mandating there, automatically the demand of Aadhaar gets generated. So it's up to you to carry and go fill a form in a bank or in a postpaid connection of a 20-page, or take a mutual fund with a 20-page of your KYC, or you are happy to give your thumb as a KYC. Okay. So we enabled other things. And why you must be saying like why it is not mandated. See, if we mandated, I just answered like if 5 lakh hospitals, assume it's not an actual number, in Tamil Nadu get mandated that in 2 months you need to implement it, otherwise your all hospital license will be withdrawing and we're revoking all that. Right now, in that context, do we have that supply ready? And it is not GST that I just simply roll out overnight and I'll make a kiosk. If this kiosk will happen, it's a peasant life. Something goes wrong in this stuff, it will be really bad. Because there are certain things which people and like you and me need to go and educate them the importance of that. By educating that, creating a market, doing this, we have all seen what is the need of firewall. All of you are techies guys, right? In the small time, I mean, if today also you might have struggling, why to take layer 3, layer 3 switch, layer 2 switch, or will take a simple D-Link and TP-Link. Who is my TP-Link and D-Link customer, and who is my Cisco, HP, and Juniper customer, right? So similarly, the market is very, very, very scattered, very differently managed, and as you rightly said, it's very unorganized market. But things are moving ahead. People are embracing the digitization. They realize they're realizing the data importance, and slowly they also realize if I don't have that type of tool, I will remain backward. Somebody is using EMR, they know entire profile of my community. And with this incentive program, if I'll answer you, Ashokji, imagine you are a pharmacy, small, and you are taking 20 rupees from government of India for one pharma things, or maybe one things, and I just simply passing that to acquire a patient. I don't want to keep it. My lot of indirect cost I can make. I can buy 2 lakh, 3 lakhs of incentive every month. I can buy 5 computers. I can put 2, 3 data entry operators, right? So there is no capex investment. I need to do this. And for this 1 and 2 year, the moment I'll establish the government of India's incentive, I can establish my entire infrastructure with that.
Okay.
And I'm saying one more thing to all of you. This is not a end of a life for incentive. It is started just years back, keeping these 2 people. Now this program of SIDH is starting. I may get 20 feedback from people like you. That Sandeep, if you can think on making this incentive slightly this way, it will more impactful to get adoptions in the ground. And then we'll again do every 6 months, we do a policy meeting. And every 6 months, we revise the new policies and we define the new policies for that.
Good. Thank you.
Anybody else? Or I think all of you have been understood or been.
Yeah, I just wanted to ask a question on it is along the lines that Ashokji just asked. If you look at the implementation of the pollution under control infrastructure, which is used to support, vehicle checking on an annual basis, etc. The fee that the operator gets at the end of completing one pollution activity may seem very meager. Now, in this entire discussion, we haven't arrived at what are the kinds of numbers that we are talking about for the various activities that you're suggesting, whether it is from a margin perspective, whether it is from a ticket size perspective, in order for us to evaluate what is the business opportunity that we are referring to. So can you throw some light on that?
Sure. Good. I mean, good, you have asked these things. I mean, that's a bottom line for every businessman, right? Whether I'll pursue this OEM or pursue this OEM, what's the market size and what quickly I'll make out of that, right? So let me answer this. I mean, of course, there is a very huge business opportunity and huge market. I mean, all of you can realize that. That's for sure. We all of you, right? I mean, the potential is too high. Today, if you say, I mean, the ticket size is very unstructured in this particular area, right? You have a very good price points. I mean, if I'll ask you what is the cost of a tier 2 layer 2 switches, firewall, entry-level firewall, and then you can give me some type of, figure and all that, right? If I'll ask you what's the cost of a Tally license for this much of users, what is a Microsoft Dynamic license, what is SAP license, what is Office 365 license cost, you will give me some sort of figures and all in that, right? Unfortunately, in this segment of HIS and EMR, there was no organized price discovery. There is no market which exists. I mean, the same IP people, because I was the manufacturer. I was developing the software. It's completely a proprietary business. I decide the price. I go and sell that product to 5 lakh rupees to some small hospital. I go and sell the same product to 50,000 rupees. So it's completely, I mean, uncontrolled, unwaved in this segment as of now today, if I'll say. But the moment, because there is no, how do I say, there is no standards. In Tally, you cannot do the way you wanted to do it, okay? There is this accounting standard built in that. And as an accounting standard, you have to take that, whether it's a double entry, whether it's accurate accounting entry, and this is the way it's been designed. In the health, except that standard billing, GST and all, in the clinical side, there is no standards. Everybody want to keep the way they wanted to keep the record. Nobody is asking them, why you are sending me the record in this way? You have to send me the record in this way. Only 4 years back, Government of India has defined during the COVID time, this is the format of a e-prescription. If you're going to generate, these are data points you need to capture in a prescription. Without that, e-prescriptions are not valid, right? So is there any way that is it defined that this is the way of discharge summary? This is the way of a lab report. This all things has been now done. Things has been all defined. Now the product value will come out in that. There will be effort. Integrating with 42 APIs is not an, cakewalk. Okay. Somebody need to put a lot of effort. The quality software need to come out. If I was doing a coding at a home and selling 5,000, 10,000 rupees in my, gullies, hospital and nursing home, don't have that much competency to build those engineering product and to come out. So the market is now getting more structured, more organized in this way slowly, and then the price point will come out. Of course, usually if I'll give you some past data, how people worked in this segment, this is my personal experience also, because I also built that with my last organization, a huge healthcare BU for Inspira for close to 100 crore. Okay, and in the same market in India. Didn't went out to do this, right? What was my strategy? What was my thing and all? It was all my trade secret, which I've done it. Because I went into deep of that market. I've done some OEM acquisitions, took some stake in that. I ensure that there will be exclusivity with me. I play with only government segment. Okay, this would be my ticket size. My transfer price always would be that. My commitment to you always every month is this. Basis this, I built my business plan. It's a huge, huge thing, right? And it is not new, I'm telling you. It is happening for last 5-10 years, and Inspira and a lot of other players have disrupted this market and created 100 crore of healthcare business and made exit also in 6 years. In 2015, Inspira has invested and then made an exit in last December from that health business. Okay, so traditionally, if I'll say, I mean, in this area, there are 40 to 50% license margin people OEM used to give. It's completely up to you and OEM to decide how you're going to communicate, how you both are open, because it's matchmaking job which we are doing it to a one platform, and completely it's up to you and to him that you are a potential SI for him to get into the market, or he may also look for some more people. That who is the guy who know this well, that I will be manufacturing and he will be my great reseller, BD guy, and create a huge business segment for me and manage the L1 and L2 support. I don't have to bother for anything. That's it. I'm ready. I will grow, he will grow. So that type of thing you need to define. And today it is not honestly like Microsoft, HP and all, but trying to copy a lot of learning from all of this in this program so that this will become more sustainable with a shorter time, right? And everybody should, capitalize this. Initial days, I won't say it will be a very immediate low hanging that you will start generating profitability in the first 2 months, 3 months, 6 months. Okay, it may be a 1 year later down the line, you may create. Okay, in the post sales, I'll say again the margin goes from 30 to 20, 25%. Some, it's a roughly calculation, depends, because it's not this market and this ecosystem was never built as of now. That need to be get built, that need to be get defined. Some people like you to come in and to define this guideline, and you may be a pioneer in defining these guidelines. That this is the business segment and this should be a margin, otherwise you cannot survive in the market.
A connected question with the same question would be from whatever discussion we've had, as the opportunity that is available for us, it seems like primarily the last mile servicing only, system integration servicing for the last mile. There is nothing at a higher level that we are looking at as an opportunity. Would that be correct?
I would like to answer it in a little different way. Let me assume one case, like you are a system integrator and you are already in the ITS business. You are a reseller of all IT infrastructure. You are a reseller of, let's say, all softwares like Microsoft Office 365, all the ITs, right? And you are also, let's say, assuming a reseller of Tally. So if I, Inderji, can you please mute? So
you are also muted. Please wait.
oh, sorry. So in that way, cross-sell and upsells is completely up to you. I mean, let's say you have an account with the ABC hospital where they have taken all the endpoints from you, all the licenses of IT from you, And any small hospital from this range, 10 bedded to a 200 and 300 bedded hospital, you know the IT bomb of that particular, an IT budget of that. That these guys going to make this much every year as an IT budget, this much in infrastructure, this much in a manpower salary, this much in a services, this much in a software, this much he puts in the renewals of infra and softwares and all. There may be a demand, like if I'll sell this EMR, there will be more structure. I may tomorrow sell these guys a BI, a fantastic insight tools that he today doesn't have understanding because he keep his finance somewhere else. He keeps his clinical data somewhere else. And he don't make an intelligent software that how do you going to acquire the market? He don't have any CRM tool today, right? So is there a 2-3 stuff which I can upsell in this particular account? Can I become a one single shop for him in the hospital? That he's only buying one item for me in the IT. Now tomorrow he can buy a 5 item of his IT from me. So this is how, like, I would say. I hope if I'll answer it or not answer
Yeah,
it.
so primarily it is last mile system integration. There is nothing that one can look at from a higher end perspective. Fine.
Give me an example. Give me an example, then maybe I'll able to answer
So,
it.
for example, like the startups, etc., that you've suggested, who are the EMR vendors, there would be some information security. There may be some data security. There may be some DP related. That is not at the last mile. That is at the place where you are developing the solution or developing the participating in the platform. What from the entire conversation till now that comes out is that the opportunity is the last mile system integrator related support, license sale, maintenance kind of an opportunity. There's nothing beyond. There is no higher end work that is involved from a solutioning perspective.
Yeah, of course, because see, the last mile is the people. And again, if I'll tell you, I mean, I'm not supposed to, but since this is a different forum, more towards same fraternity where I worked long back, if I would have been in a position and I need to make a GTM strategy, okay, which we have done it. I collaborated with an OEM who doesn't have a platform, who doesn't have a right product, who doesn't have a product who can generate a 1,000 or 1 lakh licenses in 1 second, doesn't have a SaaS model. But I do have that competency. Can I collaborate with that type of OEM who's already there, and I can help them to build that particular segment as a co-partner of that? Maybe not it is directly SIDH, but it is an opportunity. And I co-built a certain thing with him. And though I am SI, will be reselling, but he will be also become my customer. I don't know. Right? And the similar way, when I've done it, and I acquire 100 hospitals, and today I want to see, as a SI like you, I have 100 hospitals as a customer. Can I sell all of them a SOC from my hosted cloud without implementing anything? Can I manage all these 100? Do I need to ask OEM, HIS? He's selling his product, I've done it. Now I have created this 100 hospitals network, which I can, lot of things I can operate sitting from this, and I can sell a lot of managed services from my side. So you have an opportunity to create that market. See, today there is no demand of data security and all in this segment, but tomorrow if this small stuff will going in, you all have seen banking today, right? If I'm not wrong, maybe little dated information, in banking, there is a state guideline. In a one router, you cannot terminate 2 links. I may be wrong. Long time I was told. So there is a demand. If you're buying 2 links, you have to buy 2 router. I could have managed with the 1 router 2 links. Nobody is stopping me. Right? So today, if I say these things were not needed in that particular segment, then there is a demand indirectly started generating. This market is completely not yet been to that. The moment they will start consuming payment gateways, the moment they start consuming a lot of data ingestions, a lot of data tools and all, the moment they started, integrating with a lot of IoT device and these stuffs, the moment they're open for the APIs interaction with this much of things, do you think the segment which is not yet digitized and the segment which has the domain which has been already digitized, who knows better than you what was the demand that segment of the banking has generated for people like us? And the potential of this particular segment and domain is to generate a similar demand or maybe better demand in a very shorter time. But we all need to contribute and go and do that creation of a demand. So it's completely up to us how we'll take it forward. Shall we wait for a demand to be generated, then jump in that market? Maybe it has been too late. Somebody has already acquired. Or maybe I had a different plan. So I would answer like that.
Thanks, Sandeep. I
Can
think we will also
I
be sharing
have,
the recording with people who could not attend also. And I
Sure.
saw on one of the slides you have given your contact details.
Yeah.
So then we would like request members how they can.
I'll share the slide deck with all of you.
Yeah.
So this
yeah.
is the slide deck which I made for this forum only.
Sandeep Ji,
And
can I have one question? Can I?
Yeah, please go ahead.
Yeah, I'm just Sandeep Ji, I'm just trying to understand from you. You said there are a lot of mandates and everything that government is implementing through the system. What is there a segment dedicated to cybersecurity requirement? I know you were talking about data privacy, but data privacy would become only is a major part of the whole hospitality industry. But what about cybersecurity? But because cybersecurity will cover many other aspects which is not covered under data privacy. So is there a segment dedicated to that, a mandate which, under the whole government's mandate for hospital industry?
ma'am, automatically it will become, see, it has become mandated to all EMR vendors who are going to have or host or give a ABDM compliant software has to complete all the security certifications. They need to have it and defined by Government of India. Without that, that particular software is not. So we started with the software. Okay. That's a mandate. So no software in which says I'm ABDM compliant is not passed through the guideline and the things which has been made by Government of India on the cybersecurity side and the data protection and data side, right? Because a very secured, very important and very valuable data you are getting exchanged. It's not finance data that 10 रुपया यहाँ से वहां चला गया गलती से या 1000 रुपए चला गया. It's a percent important stuff which in DPDP you have seen the most critical information category में health को लाया गया है, health के data को लाया गया. ठीक है, तो अभी तो सिर्फ एप्लीकेशन को किया है ताकि इस इकोसिस्टम को भी सारा आस्ते आस्ते करेंगे. फिर उसके बाद ऑब्वियसली जब मैं अस्पताल में इतना सारा डेटा जो मैं पेपर पे रखता था, अभी वो पेपर वाला डेटा सारा का सारा अब यहाँ पे जाएगा. अब उस डेटा की वैल्यू पता चल गई लोगों को कितनी ज्यादा है. ऑब्वियसली दिस गोइंग टू बी क्रिएट अ ह्यूज डिमांड. आज आप बताओ, हम लोगों को भी तो अवेयर नहीं था. इंडियन वी ऑल नो, हमारी वाली जनरेशन जो थी, हमें तो पता ही नहीं था कि ऑफिस और ऑपरेटिंग सिस्टम के लिए पैसे भी देने होते हैं. हमें तो इतना ही पता था कि लैपटॉप खरीदना है, बस उसके साथ में सब कुछ मिल जाता है बाय डिफॉल्ट. आज वाली जनरेशन को थोड़ा बहुत समझ भी आ गया, सब्सक्रिप्शन लेना पड़ता है.
Yeah, my daughter would know that. Maybe
Right.
I didn't know, but my daughter knows that.
See, we have all seen this. So this segment of hospitals, health and all, people are not actually left little behind 5-6 years back. I mean, they need to start, and we cannot impose day one mandatory of all 20 items. We have to slowly start the journey because we don't want to create and make their life hell, because their main core purpose is to serve patient. We don't want to disrupt them for this all stuffs. We want them to serve that patient, and these tools, these changes, these stuffs, they should start embracing, and they should start self-realizing that this actually helping them to become more efficient. And they can give the better patient care and patient quality to somebody.
Okay. Thank you, Sandeep Ji, for clearing that out.
So I believe I have answered it, ma'am, somehow.
Yes, Sandeep ji, that was helpful. Thank you. Can you hear me?
Thank you, Sandeep. I think
Thank you so much.
you
Thank
have
you so much,
clarified so many
Vinod ji, and
doubts.
thank you
Yeah.
everyone for your great time and wonderful interacting with all of you. Namaskar.
Bye.